Try and send it to you.
All right, welcome everyone to the session. We're going to give folks another minute to join, and then we will be able to begin. All right, well, welcome everyone. We're very happy for you to be able to join us today for the CDC listening session. And I will go ahead and turn it on over to NIHB Board of Directors, Lisa Elgin. Thank you, Lisa.
Good morning or afternoon, depending on where you are joining us from. I am Lisa Elgin, Chairwoman of the California Rural Indian Health Board and Secretary to the National Indian Health Board. It is my pleasure to welcome you to the CDC and Prevention Listening Session of the 2021 National Tribal Health Conference. Before we begin, please note that this session is being recorded. If you do not consent to being recorded, you are asked to drop off the session at this time. Thank you. As is customary, we will start this meeting in a good way with an opening prayer. I'll provide that. Oya Kapade, Creator, we say Yahweh, thank you for so many things, but thankful for today. Thank you for bringing us here today. Thank you for gathering us here today. We ask for continued prayer and healing for everyone in the nation, with our elders, our youth from every corner of the region. And we ask that you bring us together to unite and bring our minds together. Keep us uplifted. Help us uplift each other and let us just unite in what we have to do in keeping our health care just so important for everyone. And we ask that you walk this way, continue to guide us and just give us the hope, strength, and courage that we all need to continue on our mission and what we're set here to do. I know you have a plan for all of us. And with that, we'll come together and we'll make things happen and we'll keep things good because that's what you're about. So we ask that today and just continue to let us have a good meeting throughout the day and be with everyone that's needing it. And we say that in a good way. We say, Yahweh, thank you. Oh, oh, oh. During this session, we will be speaking with Dr. Jose Montero, Director of the Center for State, Tribal, Local, and Territorial Support, and other key CDC leadership. We appreciate the engagement with Dr. Montero and other CDC leadership. And we look forward to discussing a host of issues that are important to our tribal nations. To lead this session, I'm also glad to be joined by the NHB Navajo Nation alternate and Vice President of the Navajo Nation, Vice President Marlon Lizer.
Thank you, Chairwoman Elgin. It's good to see you again. Good to be with everybody here in IHP. Yate from the Navajo Nation. As you mentioned, we have seen so many topics of discussion on today and on current and ongoing public health challenges affecting tribal nations. Emergency preparedness and concerns around the ongoing COVID-19 public health emergency are, of course, at the front of everybody's mind. So, however, other public health challenges also need our attention, including the tribal public health capacity and infrastructure, tribal public health data, and ongoing opioid epidemic, among others. We look forward to meaningful engagement and discussion today, and we welcome the opportunity to strengthen our partnership. As tribal leaders, we appreciate the time we have with the CDC so we can share our guidance and recommendations on a variety of issues. This is a dynamic time, and we want to ensure that the tribal leader perspectives are heard, understood, and incorporated in this agency's work. To start us off today, we have a welcome video from Dr. Rochelle Walensky, Director of the Centers for Disease Control and Prevention. This will be followed by some comments and updates from Dr. Montero. After that, we will open our discussion portion of the meeting. So now a brief video from Dr. Walensky.
I'm honored to open this listening session with you today and welcome the opportunity to reaffirm our government-to-government relationship on behalf of CDC and ATSDR. We strongly support and respect tribal sovereignty and self-determination for tribal governments in the United States and look forward to our ongoing collaboration to protect and improve. To study and report on vaccine effectiveness and vaccine safety. Early in September, we published a study in the MMWR looking at COVID-19 cases, hospitalizations, and deaths in 13 jurisdictions. In this study, over 600,000 COVID-19 cases from April through mid-July were evaluated and linked to vaccination status. Looking at cases over the past 2 months, when the Delta variant was the predominant variant circulating in this country, those who were unvaccinated were about 5 times more likely to get COVID-19, over 10 times more likely to be hospitalized, and 11 times more likely to die from the disease. As we have shown in this study and many others, vaccination works. And so CDC will continue to do all we can to increase vaccination rates across the country by working with local communities and trusted messengers like you, and providing vaccine confidence consults to make sure that people have the information they need to make an informed decision about vaccination. On August 23rd, FDA provided full approval for the Pfizer-BioNTech COVID-19 vaccine for prevention of COVID-19 in individuals 16 years or older. While vaccine hesitancy has not disappeared, we have seen vaccination rates rise with this evidence of our faith in the safety and efficacy of the vaccine. Still, we are just shy of having 55% of the country fully vaccinated. While primary vaccination in the United States and around the world is our most important focus, FDA and CDC have recently taken steps to recommend booster vaccine doses as we work to stay ahead of the virus. CDC's updated interim guidance allows millions of Americans who are at highest risk for COVID-19 to receive a Pfizer-BioNTech COVID-19 booster shot to help increase their protection. At CDC, we are tasked with analyzing complex, often imperfect data to make concrete recommendations that optimize health. In a pandemic, even with uncertainty, we must take actions that we anticipate will do the greatest good. I believe we can best serve the nation's public health needs by providing booster doses for the elderly, those in long-term care facilities, people with underlying medical conditions, and for adults at high risk of disease from occupational and institutional exposures to COVID-19. This aligns with FDA's booster authorization and makes these groups eligible for a booster shot. Many Americans are also eager to know when vaccines will become available for children under 12, another important step in bringing the pandemic to an end. Because young children are still growing and developing, it is critical that robust clinical trials of adequate size are completed to evaluate both the safety and the immune response to a COVID-19 vaccine in this population. This could include whether there's a need for different doses or different strength formulations of vaccines already used in adolescents and adults. Clinical trials assessing COVID-19 vaccination in children are underway, and once they are finished, those data will be evaluated by FDA. Once FDA has authorized or approved a vaccine for children under 12, the Advisory Committee on Immunization Practices will meet to make a recommendation based on a thorough review of the available evidence. COVID-19 vaccines have undergone and will continue to undergo the most intensive safety monitoring in U.S. history. We are committed to providing the tools to help protect our children against COVID-19. CDC and our Advisory Committee on Immunization Practices will continue to follow the science, and evidence will inform our decision-making about vaccination for those younger children. It's also important to acknowledge how tribal nations have helped lead the way in getting people vaccinated. They vaccinated not only their members, but also community members and neighbors outside of their tribes. As of the end of August, over 2.1 million vaccinations have been administered through the Indian Health Service, Tribal Health, and urban Indian organizations enrolled through Indian Health Service or their state. Thank you for your efforts, which have provided much needed support to the country and to the entire public health system. CDC is committed to standing in partnership with tribal nations against COVID-19. We have expanded funding, provided remote technical assistance at the request of tribes, sent CDC experts and staff on field deployments, and provided support for COVID-19 vaccine implementation. The Tribal Support Section in CDC's Emergency Operations Center has deployed a total of 62 tribal support teams made up of 334 CDC staff to 30 tribal nations, 4 Indian Health Service areas, 1 tribal council, and the Bureau of Indian Education. CDC deployment teams provide hands-on technical assistance to tribal leaders and local public health staff on a variety of COVID-19 risk mitigation strategies, including vaccine hesitancy, testing and contact tracing, communication campaign development, use of surveillance data to inform decision-making, and K-12 school reopening. In fiscal year 20, CDC provided approximately $425 million directly to tribes and tribal organizations through cooperative agreements and grants. This is more than twice as much funding as provided in fiscal year 2019. Of that total, CDC directed over $200 million to supplement existing tribal programs to create a new non-competitive grant for tribes. CDC was able to reach 379 unique tribal recipients, almost 4 times as many as the previous year. And some recipients received funding through multiple cooperative agreements and grants. This funding was used to address the immediate needs of the COVID-19 response and to strengthen tribal health infrastructure and capacity. There are also many ongoing and upcoming CDC investments in tribal health across the agency at CDC. On July 23rd, CDC posted a forecast on grants.gov for the second round of funding for CDC's Tribal Practices for Wellness in Indian Country Cooperative Agreement. This funding supports tribal practices and cultural traditions to build resiliency and connections to community, family, and culture. Over time, these can be used to reduce risk factors for chronic diseases and promote health and wellness. Recipients of the new round of funding will include up to 18 federally recognized American Indian tribes, Alaska Native villages, or American Indian or Alaska Native tribally designated organizations serving a specific tribe, reservation, or native village, and up to 12 urban Indian organizations. In response to the disproportionate burden of maternal mortality among American Indian and Alaska Native populations, CDC's Division of Reproductive Health is supporting the National Indian Health Board in working to assist tribes and tribal organizations in exploring the possibility of designing and implementing tribally led maternal mortality review committees. In the coming year, NIHB will provide in-person and virtual trainings and will support Indian health boards and tribal nations directly via grants and technical assistance to conduct a readiness assessment. They will also build a resource library on maternal health and maternal mortality in Indian country. And on August 1st, our Division of Violence Prevention awarded $100,000 in additional funding to NIHB for a continuation of their project to develop culturally tailored materials and trainings on adverse childhood experiences. I'd like to close by touching on one of my top priorities as director, health equity. Back in April, when I declared racism a serious public health threat, my intention was to force us to reckon with long-standing racial and ethnic health disparities that are severe, far-reaching, and unacceptable. And at CDC, we are looking internally, embarking on an agency-wide strategic process that will make sure that health equity is central to the work we do, that every center, every division, every program is advancing these efforts. On July 31st, each part of the agency collectively submitted more than 150 health equity science and intervention goals that describe how we will continue to study the drivers and impacts of social determinants of health outcomes, expand the body of evidence on how inequities affect health, and propose and implement solutions. The submissions were impressive and testimony to our ability to weave health equity into every program at CDC and to implement transformative actions that will improve the health of all Americans. I look forward to sharing the plans with you at a future meeting. Through this work and working with you, our partners, CDC will holistically transform the way we approach public health within the agency, across the nation, and around the world. Again, I'm grateful for the opportunity to address you all today. I will now turn it over to Dr. Montero and others within CDC who will be on to hear from you all as we continue our work together to advance public health.
We would like to thank Dr. Vilniski for taking the time to provide us with those informative remarks. And now to start us off with some important CDC updates, it is my pleasure to introduce Dr. Jose Montero, Director of the Center for State, Tribal, Local, and Territorial Support, where he oversees support to the U.S. health departments and those serving tribal nations and insular areas. He provides leadership for key activities and technical assistance designed to improve the public health system capacity and performance to achieve the nation's goals in population health. Dr. Montero will be joined by Captain Mark Anderson, lead of CDC's Emergency Operations Center State, Tribal, Local, and Territorial Task Force, Dr. Mark Stenger, lead of the Tribal Section with the Center State, Tribal, Local, and Territorial Task Force, Dr. Melinda Wharton, Associate Director for Vaccine Policy at the National Center for Immunization and Respiratory Disease, and Dr. Aaron Trumbull, Chief Medical Officer for CDC's Emergency Operations Center Vaccine Task Force. Welcome to all of you. Dr. Montero, it is so good to have you with us. Thank you for making the time to be with us for this important meeting. I will turn the floor over to you and your team.
Thank you very much, Chairwoman Elgin. It was great to hear Dr. Walensky's updates for the National Indian Health Board thank you all for hosting a CDC listening session during this conference. We really appreciate the opportunity to provide these updates and mostly, more importantly, to hear about important public health priorities in Indian country. I am here with Captain Carrie Hurd, and I want to mention her because in this Zoom world, every now and then we get dropped off calls. If for whatever reason I disappear or you lost my audio, Captain Hurd will continue on my behalf wherever I drop. So, in our center, as represented from CDC, CISTLS has the Office of Tribal Affairs and Strategic Alliances, where Captain Hurd is the director. Through this office, we serve as the principal contact for all public health activities that affect American Indian Alaska Native communities. So specifically to CISTLS, you may know that we coordinate two large umbrella cooperative agreements that support tribes and tribal organizations to build and improve public health infrastructure and capacity. These are the Tribal Public Health Capacity Building and Quality Improvement Umbrella Cooperative Agreement, that technical name is OT-18-1803, and we have the Strengthening Public Health Systems and Services through the national partnerships to improve and protect the national's health, which we call OT-18-1802. So speaking of infrastructure and capacity, CISTLS also leads the Public Health Associate Program, or PHAP. PHAP is a 2-year training program that gives early career professionals hands-on experience at federal, state, local, and tribal public health agencies and non-governmental organizations across the US. In the fiscal year that just ended last Friday, 2021, 26 public health associates work at tribal host sites or in tribally focused assignments. And each year, we are actively working to increase the number of tribal host sites for these programs to provide public health workforce support through Indian country. Finally, I want to announce that the CDC ATSDR Tribal Advisory Committee has opening for 4 delegates, one each from the Billings, California, Oklahoma areas, and 1 tribes at large position. So again, Billings, California, and Oklahoma areas, and 1 tribes at large position. More details you can find in our Tribal Advisory Committee recruitment in our website, but I have seen that NIHB has shared that information on their communications as well. As mentioned earlier, I am joined today by several leaders from our centers, institutes, and offices, as well as leaders of the COVID-19 response. We want to listen to your experience and address your questions as much as we can. We cannot always answer specific technical questions if they refer to an area for which we don't have anybody in the meeting today, but we will get your question, get the answer back to you. So, as mentioned, from the National Center for Immunization and Respiratory Diseases, we have Dr. Melinda Worden, who is the Associate Director for Vaccine Policy. We may have now or later on Dr. Jay Butler, who is the Deputy Director for Infectious Diseases for the CDC. And we have Dr. Erin Trumbull, the Chief Medical Officer for the Vaccine Task Force, Captain Mark Anderson, the Deputy Incident Commander for the State Tribal, Local, and Territorial Task Force, and Dr. Mark Stenger, the Tribal Support Section Lead of the STLT Task Force. So, thank you very much. Back to you, Chairwoman or Vice President Lizer.
Thank you so much for those updates and that important information. Now we will start the discussion portion of the meeting. Like other listening sessions, we will follow tribal protocol and invite our elected tribal leaders to make comments, share recommendations, and ask questions first. Once our tribal leaders have had a chance to speak, we will open the floor to other members of our audience. Our NIHB Board of Directors have a few questions to start us off with. I would like to invite my fellow host, Marlon Lizer, to ask the first question.
Thank you, Lisa. Mitigating the risk of COVID-19 and emerging infectious disease threats is an ongoing process. During the course of the pandemic, we have seen the emergence of new variants and that have continued to put tribal communities at risk. To coordinate efforts to fight COVID-19 and any future outbreak, CDC needs to hold meaningful tribal consultations on a regular basis. Request. We ask that the CDC engage with tribes on future COVID-19 and other infectious disease threats, planning, response, and mitigation efforts. Question. What is the CDC currently doing to help mitigate the risk of the Delta variant and any future variants that may emerge? Question 2, can you share any information or data about the variants that may be present in Indian country? Request, we ask that the data be shared with tribes and tribal epidemiology centers. Question, is surveillance being done on a national level on the Delta variant in the Indian country? And a request, lastly, if so, we ask that the surveillance data be shared with tribes and tribal epidemiology centers. Thank you.
Thank you very much, Vice President Lizer. Certainly many interesting and important questions. So let me try to get a general approach, and I will then open to my team to see if they want to expand in any specific area. So we do agree with you. We need to have a more regular and formal consultation from CDC. We held a consultation back in August, right after our Tribal Advisory Committee. We actually held a consultation in our own consultation policy because we want to engage on a more regular basis on that. Our current plan is calling for at least 2 consultations a year. For the first year, we're trying to tie those to make them right after the Tribal Advisory Committee, so we can have a sequencing, discuss things with our advisory committee that help us and help you get prepared for this formal and important for the discussion, the formal consultation. So yes, we do have that as part of our plans. Now, as a nation, we have countrywide surveillance system for variants. As we may have said and published in our website, this national surveillance relies on the collection of samples from all over the country. Since more than 6 weeks ago, Delta has become the predominant variant in the US. More than 99% of the cases that are sequenced have that particular variant. We saw that they replaced all of the other variants that we had before. And we keep monitoring through our national and international partners the emergency, if they are emerging any other variants that are of public health interest. That's not the right term, but that's what allows us all to know that we are doing that. So we keep track of that globally and in the US. I do not have with me any specific data that will tell me if there is a difference specific for tribes. But looking at the national data, 99-something% of all the variants that we have identified in the last 6 weeks are Delta. So there is no reason to believe that there is a difference in any particular group, set, or population. We will continue to mine our data to see a different level of granularity, to see if maybe we can identify any particular region in the country or tribal nation that may have a different epidemiological profile. We are in the process and working on how to better engage on sharing data with tribal epidemiological centers that has been going on since last year. So that is a lot of process and a lot of work going on that direction. And I think that those were your questions. If I missed one, I apologize. That's what I had the chance to write. And I want to open to my team, to the CDC's team, Captain Anderson, if you want, is anything else that I missed, or Dr. Thumper? Stenger, I'm sorry, change your last name.
Thank you, Dr. Montero. I think you summarized it very well. There are a variety of national surveillance systems for variants, as Dr. Montero described, where samples are collected from across the country, typically coming in from public health labs at the state level and national level. But I am not aware of any data that is specific to tribal nations. And I'll turn it over to Mark then.
Thank you, Dr. Anderson and Dr. Montero and Vice President Lizer for the questioning. The Tribal Support Section has reached out and actively worked with the Tribal Epidemiology Centers. So we have been sharing internal data that we have within the COVID-19 emergency response proactively with our Tribal Epicenter partners. We also continue to offer support to any tribal nation or tribal organization with respect to the most recent Delta variant surge. And we stand ready at any point to assist. As long as we are stood up in emergency response, we will be available to our tribal partners. Thank you.
Okay, I guess that's it, all the answers. Thank you for all those responses. And now I would like to invite my fellow board member and chairman of the National Indian Health Board, Chief Bill Smith, to ask a question. Chief? Is he on?
Lisa, can you hear me?
Yeah, I can hear you.
Oh, thank you. I was just getting on this meeting. I just got overdone with my other one. So thank you for this time. On Wednesday, September 22, 2021, the FDA authorized a booster dose of Pfizer COVID-19 vaccine for people 65 or older, people 18 to 64 who have increased risk severity COVID-19, and people 18 to 64 who have frequently exposed to SARS-CoV-2, putting them at a higher risk of serious complications. I got 2 questions and 1 request. What support will the CDC offer tribal communities to assist in the administration of the booster shots? And the request is that culture appropriate and easy to understand education material be made available on the booster shots. And the second question is, Indian country has done a great job in vaccinating our people. However, there are some that are still vaccination hesitant. What material is available to the tribes to help combat vaccine hesitation? Thank you.
Thank you very much for those questions. Dr. Trumbull or Dr. Wharton, do you want to take a first pass at that?
Hi, I can start. So I know that the vaccine task force, as one aspect of the larger CDC and U.S. government-wide activities, is working to work really closely to develop strategies to disseminate vaccine, particularly to areas that we would traditionally consider hard to reach. And has a lot of implementation strategies in place in order to help disseminate vaccine. Particularly, I know that in some areas there are challenges related to Pfizer specifically because of its specific refrigeration requirements. And we have our distribution partners are working really closely to reach out to areas that may have challenges so that we can disseminate. And so I would suggest coordination through the STLT group that Dr. Anderson and Dr. Stenger work with in order to align with our partners and our distribution partners and get the strategy and product aligned with your needs. I've forgotten now the second part of the question, apologies. Can you read back either the request or the question? I apologize that I lost track of it.
The request was that culture appropriated and easy to understand educational material be made available on the booster shots. And all we know so far is the Pfizer, but we don't know anything about the Moderna or the J&J.
That's right. And you also asked about vaccine hesitation. We do have some resources related to vaccine hesitation that I can try to find the links to. I apologize that I don't have them at my ready at the moment, but I can try to pass those along to the NIHB, to the board, that may be helpful, and that we've actually shared with some tribal nations in the past that I believe have been useful. So there are some materials that I think are culturally aligned that we've developed for that. Going back to your additional question, I think that's a very fair point. And I know that our groups, our communications folks work really closely to align our content so that it is culturally appropriate. I'm not a communications expert myself, but I can certainly relay those concerns to our colleagues and make sure that your request is relayed to them.
Thank you very much for those responses.
Chief Smith, this is Mark Stenger. I am the lead for the tribal support section. We actually have a number of vaccine coordinators on our section who work proactively to make sure that materials are available that are tribally appropriate. And we also do fairly comprehensive vaccine confidence presentations for tribal groups. And please do reach out to us at CDC event 362 at cdc.gov, and we would be delighted to put together specific tribal related vaccine hesitancy webinars that are targeted to either general populations within your tribal communities or in school settings as well. We work very closely with our school support section to support vaccination in the school communities as well. Thank you.
Thank you, Mark, for those.
And that email had been just posted on the chat in case that you didn't have the chance to catch it. Dr. Wharton, I'm sorry, you were going to.
Yeah, the issue was raised about boosters or supplemental doses for the other two products, Moderna and the Janssen vaccine. And late last week, the FDA did announce that their advisory committee will be discussing this at a meeting October 14th and 15th. And so, that is usually what precedes an FDA decision. So it seems like that's likely to happen pretty quickly.
Okay, thank you, Melinda. And the reason I'm asking is because I didn't take the Pfizer, I took the Moderna, and everything is right down there for the Pfizer right now. But as an older Vietnam vet, I'm concerned about getting a booster shot for myself. Just like getting the flu shot and getting everything else to keep me healthy, to maybe get one more trip around the sun. So it's good to know that it may be coming. Awata, thank you.
Understood. And I think it'll be pretty quick.
Thank you.
Yeah,
By
sorry,
the way, since you mentioned flu vaccine, please go for the flu vaccine. Those can be administered at the same time. So please get vaccinated against both things. Sorry.
No, I apologize, Dr. Montero. I just wanted to add to Dr. Wharton's comments that not only is FDA planning to look at that additional data, but I can also say that our ACIP, or the Advisory Committee on Immunization Practice, is gearing up to be very responsive to quickly follow with decisions once we're able to move. But the typical process is FDA makes their decisions, and then CDC is able to issue recommendations based on FDA decisions. And so we are really planning to be closely aligned because we hear your concerns. We know that it's very stressful for folks who received Moderna and other products. And so we're very attentive to that and ready to move quickly.
All right, and thanks also for the information about being able to get the flu shot and the booster at the same time, because that was one of the concerns that a lot of us had. Is there a time frame between each one that we need to get it? Because for me, a lot of times it's a 300-mile trip up to see my Indian Health Service to get my shots that I need. Thank you. Awata.
Oh, thank you, speakers. Appreciate all your responses to that. And so now I would like to invite my fellow board member and NIHB Vice Chair, Councilman Nick Lewis, to ask a question. Nicholas?
Thank you, Lisa. Can you hear me okay? Okay.
Yeah, I can hear you.
Okay, thank you. The CDC provides funding to build preparedness and response capabilities. Currently, the CDC has public health emergency preparedness cooperative agreements with all 50 states, in addition to 4 cities and 8 US territories, which leads to the question, why are tribes not included in these cooperative agreements? And if they are, what is needed for tribes to be eligible or to be able to obtain the funding? We request and ask that funding go directly to tribes and not funneled through the states. We have seen repeatedly that funding for tribes being passed through the states do not work and is not efficient. We've made that known in a number of different forms with different agencies, and yet we see it still happening today. Tribes are sovereign nations with the authority and responsibility to exercise the right to protect their citizens and their tribal lands, and would like if any light can be shed on these important issues that affect all of our tribes across the country. Thank you.
Thank you very much, Chairman Lewis, for that important question. So, 2 separate things, but they are complementary of each other. So, the funding that goes through CPR, preparedness and response, follows the appropriations language that we get from Congress. So if Congress says you will distribute these funds to states and cities and territories, that is what we do. If they include the tribes, then we do include the tribes. So there is a limitation that it comes in some appropriation language. Around funding for emergency preparedness and response in the COVID era, last year, we put out directly more than $200 million for response-related actions and activities. And the director mentioned that 300-something unique applicants, but many applicants were covering and applying on behalf of many tribes. Like as an example, the consortia in Alaska that applies for a group of tribes. So we actually reached to more than 500 of the federally recognized tribes directly. We did change the way that funding goes out, remove the requirements, and make the application as simple as we legally could in order to applicants that didn't have a history of applying directly to CDC to be able and eligible to apply. And it was a grant. So it allowed each one of the recipients to target the activities to the actions that they needed in their own tribe, as long as they were doing activities that were tied to surveillance, patient outreach, patient follow-up. So that allowed that money to go there. Toward the future, certainly we will be interested in exploring how to maintain that approach and expand on it. Limiting factor for CDC is the appropriations language. So we need that language to include us. At the same time, we do work directly with the IHS and coordinate actions and activities to make sure that either through us or through them, the tribes are ready and able to respond and manage whatever the emergency of the day is. So that is where we are at right now. Thank you for the question.
Thank you for that response. And thank you to my fellow board members for kicking us off with all the questions. I would like to now invite elected tribal leaders in the audience to ask questions, share their comments, and provide recommendations. If you would like to speak, please put your name in the chat box and the NIHB staff will unmute you and you can ask your question directly to the speakers. We ask that you please start by stating your name, title, and tribe. And once you are unmuted, we also invite you to turn your camera on if you would like, so that we can see you as you ask your question. So do we have questions out there? AC, are you coordinating that? Do we have any questions from anyone?
We don't have any questions right now, but if you do have a question, you can also use the raise hand feature and we will call on you as well.
Okay. Give people a couple of minutes to ask the questions then.
Yes, ma'am.
Okay.
It looks like we have a question from Alita, had her hand up, but now I don't see it. Alita, can you raise your hand one more time? Okay. You are unmuted. We've asked you to unmute, Alita, so you can ask your question. Alita, we can't hear you if you're talking. You've been unmuted.
I'm getting more messages. Here we go. I guess I had to click on something else. Hi, I'm Alita Montiel. I'm not a tribal leader, so I lowered my hand quickly because I didn't want to go in front of the leadership.
That's okay. We have not received any questions from tribal leaders at this time. So the floor is yours, Ms. Montiel.
All right, thank you so much. Alita Montiel. I'm a member of the Pasco-Yaqui tribe. I'm the Director of Health and Human Services at the InterTribal Council of Arizona. And it's been an unprecedented time. It certainly has turned our world differently in terms of COVID-19. And in fact, you could think about it how a lot of us realized, maybe some more than others, that we are connected to the world. And it just fills my heart in a way that we all look up at the same sky, we all look up at the same stars. You know, we breathe this air, we drink this water. And so we have to think about our fellow peoples, indigenous peoples and all peoples. And with that, you know, CDC does more than all that you do for the tribal nations within the jurisdiction of the United States, but indigenous peoples. And, you know, we have these connections to our relatives. Myself, being a member of the Pasco-Yaqui tribe, we have family members, you know, south of the international border. And likewise, you know, they've been facing COVID-19 as well. So those kinds of efforts also are near and dear to our heart that you may endeavor in. I know it's also the conversation sometimes that our tribal leaders have because of the relationships with our relatives, you know, north and south of the international border. And so I just wanted to mention that the funding has been coming forward from CDC. At the InterTribal Council of Arizona, we have, you know, 2 or 3 projects related to COVID-19. We also have a Good Health and Wellness in Indian Country project funded by CDC. So, you know, and then the coordination that we need to do, that I feel very important to do, is coordination, of course, with all of the tribes and whatever status they have, whether it's direct service or self-governance. And then, of course, the Indian Health Service is always at the forefront in my mind in terms of coordination. And I see that happening on the headquarters level, that there's coordination with IHS, with CDC, and so forth, which is very crucial. And I appreciate that you find that of utmost importance. I just listened this morning to the IHS listening session, and a lot of things that he talked about what they talked about in terms of RPMS and how we're shifting over to a different platform for the resource protect. I can't remember the acronym for RPMS. I'll get it. It'll come. It'll sink in. I know we speak in acronym. Okay, you all know. And, we rely so much on our tribal epicenters accessing that data. And a lot of times tribes themselves are trying to get the data that will be useful to them, through the Indian Health Service. And I understand there are protocols and procedures and also permissions that have to be facilitated in order for access to data to occur. So a lot of times, we, rely on secondary reports and information because it takes some time to coordinate access to the data that we need. So thank you for that conversation today about data. I guess I also wanted to mention that one of the things that's been very helpful is the continuation of utilizing the funds through extension periods. So I'm complimenting CDC for having that policy for our programs, especially related to COVID-19 and the Good Health and Wellness Project that I'm aware of, that we have those extensions, and we're following the advisement that was sent out to all the grantees that we forward to our subawardees, the 12 tribes in Arizona, Nevada, and Utah that are the subawardees for the Good Health and Wellness Project, so that we can follow those and make sure we have a very robust finance department. It's not large, but the 3 people that are there are always making sure that we get the information and that we're following what needs to happen in terms of utilizing funds beyond the fiscal year, because we are allowed to extend and utilize those funds throughout the 5-year funding for Good Health and Wellness. We're just now starting year 3. And so just something that we deal with on a day-to-day basis. And so what you've done to help us has been, I just really commend you for that in terms of COVID-19. The reason I wanted to bring it up is because we saw these relationships transpire and reform and become improved, despite certain parameters that we have to all follow in terms of regulations and so forth. But I believe that the CDC Tribal Advisory Committee can look at what has worked well and what needs to be improved as we go forward. I'm looking forward to reduce cases in terms of COVID-19, and I just don't want to go to any more funerals. But that's life, and we've lost relatives due to other issues as well during the pandemic, where it was just hard for them to face another day of life, or their health issues caught up with them during that time. And so it's been quite a period for all of us. And what I'm just thankful for today is, like I said, that we took this water, we drank this water today, we took this breath of life, and we heard the wise words of our elders today in our hearts. So that's what I just want to mention. Appreciate all that you do, and may we not be confined so much. Let's move forward. Thank you.
Thank you for that, Alita.
Now, can you hear me?
Yes, we can, Dr. Montero.
Okay, I'm sorry. Somehow it froze on my end. So I didn't know if you were. So thank you very much, Ms. Montiel, for those words. Actually, you bring up a couple of things that are quite important for all of us to remember. It's not just the amount of illness or fatalities that we have experienced as a nation, as a people, but the ongoing suffering and pain tied to that, the impact in our lives, in our families, and the economical impact that this has had in many of our communities. Of course, communities that are racial or ethnic minorities or live in rural areas are experiencing this at higher rates than other groups. And clearly the impact on mental health is being felt. We are seeing that, we keep track of that, and we are reaching out to many different groups to work on those areas, because at some point the pandemic will end as pandemic, and we still have to continue as communities. We all have lost many of our elders, of the people who keeps the traditions, and need to regroup, and that's part of the work that needs to come. In the meantime, as we do have still the ongoing pandemic, we need to continue in the implementation of the prevention and control measures that we have. We know that the vaccine works. We know that we still have many people unvaccinated. We know that now we have the option of a booster shot that will improve the level of protection for those who may require even more as time has passed by. But washing our hands, using the mask, and keeping ourselves from congregate settings and mass events is still a valid activity, with more value in some areas of the country than others. And we look at the data, and the pandemic is different in different parts of the country. So we need to keep looking at the data, where we are, where we live, or where we go. But certainly, as Ms. Montiel said, the impact of the pandemic is going to be felt for many years to come from the mental health perspective, and we need to work on that together. So thank you for those words.
Thank you, Dr. Montero. And I believe Chief Bill had another question. Chief Bill.
Yeah, thank you very much, Awata. And just like I wish we could be in person, I had a hard time getting onto this one again and getting seen. All I saw was just a few people, and it's nice to put a name with a face. But also as a veteran, and knowing that this pandemic and the mental health is a very important issue, the returning of our warriors from Afghanistan, just like when we left Vietnam in '75, that we left some of our people over there. We need to really concentrate on our veterans that come back from the war, that they were there because it was the right thing to do. And we need to reassure their health and their mental health, because 22 a day is above and beyond with the pandemic. So we need to concentrate on that too, even though we have the COVID-19 and the Delta virus variants and all the rest of them. Mental health is very important. So thank you.
Thank you, Chief Bill. Certainly, we at CDC are fully aware of that, and we keep raising the awareness of the topic in our work with the other agencies. So we talk to IHS, as it was mentioned before, at many of our intergovernmental meetings, and we do the same with the Veterans Affairs groups. We do not, CDC does not do direct on the field mental health care. We help to finance some of the tracking and some of the prevention activities. But as we identify the problem, we raise awareness on it to the agencies that will more properly respond. But certainly it is an important topic. So thank you very much for bringing that up.
Thank you. Back to you, Lisa.
Okay, any more questions from leaders out there?
Councilman Nate Tyler has his hand raised, and you've been asked to unmute, Councilman Tyler.
Okay, I'm unmuted. Nate Tyler, McCaw Tribal Council, Washington State, delegate to the Portland Area Indian Health Board, and also a part of the National Indian Health Board. So the last three speakers brought up a really important issue that's definitely got to be addressed, and I'm not sure how we can work together with the CDC and the tribes to address it, and that's mental health. Mental health and also overdose prevention. What we're seeing here in Nia Bay this last month, we've seen well over 65 positive cases, and who we're seeing become positive is our people that have issues with addiction. So at some point, mental health is going to have to be addressed sooner rather than later. Funding, I just don't know. Vice Chairman Lewis brought up pass-through funding. Pass-through funding doesn't work when the intent is to actually fund tribes. It goes to states, and then tribes. Washington State, we have 32 tribes, and to access the monies through the state is burdensome and a lot of red tape involved. So it's the process isn't fair when there's an intent attached to the funding. So I just want to remind you guys that at some point it's going to be well worth fully addressing mental health and addiction.
Thank you very much for that comment. We do agree. Actually, our National Center for Injury Prevention and Control has developed several different activities that are specifically directed and targeted to work with tribal nations. In fact, we are directly funding many tribal nations to address issues in overdose prevention. That is part of the funding that goes through one of those cooperative agreements that I mentioned earlier. Some goes directly to tribes, some is going to tribal organizations. So we can do more and more to address that topic. We have seen that unfortunately during the pandemic, numbers are increasing. So this is an ongoing epidemic, the one in overdose. So we need to continue to work on that, and we will continue to work with many of our tribal partners on this topic. Hopefully, we will get more funding, and that will allow us to reach out to even more partners. But right now, we have many tribes that are already working with us on that topic directly, not through states. Thank you.
Okay, any more questions out there, AC? If not, Vice President Lizer, did you want to invite the general audience members?
Yeah.
Okay.
Yes, I can. Thank you, Lisa. We do wish to thank all of our tribal leaders and staff who shared their questions and comments. And if we don't have any other tribal leaders here, we do open up the floor to receive questions from the audience members at this time. So again, if you would like to speak, we ask that you put your name into the chat box, and our NIHB staff will unmute you, and you can ask your question directly to our speakers. Also, please feel free to put your question in the chat box. If we begin to run short on time, those questions can still be addressed. The NIHB staff will follow up with our speakers to make sure that all of the questions, comments, and recommendations are received. All your voices are important, and we wish to make sure that we hear you. So
This time, if you would like to ask a question, please raise your hand using the feature on the lower bar of your Zoom window, or type your question into the chat box. We do encourage audience members to participate in this listening session. This is our opportunity to ask the CDC questions that pertain to the communities we serve, and be able to talk directly with CDC leadership. So please, if you have a question, raise your hand or type it in the chat box at this time. Councilman Tyler, do you have another question?
Yeah, I got one more comment. I was recently appointed to the CDC TAC, and so this question's geared towards the TAC. My hopes is that the agency can prioritize the completion of the CDC TAC charter revision process and must prioritize the TAC's input on all changes to the charter. And also, another thing is, I'm going to have a technical advisor, and my hopes is that as the advisor, collectively would be able to engage in dialogue during meetings and have fruitful discussions. So I'd just like to encourage the CDC to consider how any types of restrictions impact the quality of discussion, and continue to work to uphold standards that reflect our tribal ways.
Thank you very much for the comment, and welcome to the TAC, CDC TAC. As you know, and you heard, we have been waiting for quite some time to receive the TAC charter from the advisory committee. It's my understanding that maybe I will finally receive that at the end of this month, and it will go through the process for a tribal advisory committee to maintain their charter and viability under the current FACA exemptions. It has to be with elected officials. We have discussed this many times at many different events, and we have legal limitations that will not allow us to go as far as some of your advisors may want us to go. But certainly, until we see in writing what the actual request is, we cannot provide a formal answer. So as a new member of the advisory, I encourage you to work with the other great, amazing people who are in that committee. And please finalize the review, vote on it, and send it to us so we can do what you are asking us, which is to review it. Thank you very much for bringing that up.
Appreciate that. Thanks.
All right, Delia, you have been asked to unmute, and you may ask your question at this time.
Thank you.
Delia, we cannot hear you if you are currently speaking. Delia, you may be double muted. You may have to unmute yourself on your side. I'm sorry, Delia, we are unable to hear you at this time. I'm going to go ahead and I'm going to ask Tracy Prather to unmute and ask his question. We're not able to hear you, Tracy, if you are talking. I do see your question, so I will go ahead and just read it aloud. Everyone across Indian country is in a different place with COVID. Different staffing levels across tribes and ability to operate at full levels within tribal health services due to some area restrictions with opening back up in all health centers. While C-STILTS and CDC does a great job of providing supplemental funding to tribal epicenters and specific programs identified, we all have different community needs. Is it ever possible for C-STILTS to provide areas block type funding so TECs could prioritize the different tribes' needs, develop customized programs that tribes identify as greatest need for their areas, and work with C-STILTS to determine a proper reporting structure and deliverables to supply to CDC with data resources to document and improve health and create sustainable increased education and health improvement programs specific to identified targeted needs? Thank you.
Thank you very much for that question. Actually, I would love to follow up. We would love to follow up with the person who wrote that. At our last Tribal Advisory Committee meeting, actually our last couple of advisory committee meetings, we have been actively engaged on the discussion of what is public health infrastructure in Indian country. So what is public health infrastructure? No, not what is the healthcare infrastructure in Indian country, but public health infrastructure as it goes toward health promotion, surveillance, tracking, investigation of cases of infectious diseases, looking at policies for chronic diseases, and how that ties to general policy. So we are trying to figure out what the right process to develop those different levels of standards and discussion with Indian country. Something that was said at the last Tribal Advisory Committee meeting in August was exactly what this person who just made the comment did is, all tribes are different. There are tribes that have the capacity to manage their own healthcare. There are tribes that have public health departments. There are tribes that don't have much or anything. And sometimes it's an issue of scale. You cannot have all of the services when you have a small number of people. You don't have enough in-house expertise. And how to figure those things is really, really, really hard. So we are going to be engaging on that discussion process. Actually, we, not just us at CDC, but all of we at HHS. At the last Secretary Tribal Advisory Committee, I brought that issue up that we were discussing it. IHS brought it up. So one of the tasks that was assigned to all of us as HHS agencies is to figure out a coordinated process between all of us so we don't have different approaches. So whatever SAMHSA, Substance Abuse and Mental Health, whatever HRSA, Human Resources Administration, IHS, us, or CMS, how each one of us plays a role in building that, first defining what the infrastructure is, and then how we go about building it. So different stages of the process. For us and the other agencies, we will be meeting in the next couple of months to figure out how we do this. And hopefully that will give us a pathway toward the future of a better public health approach, philosophy, and infrastructure in Indian country. Thank you.
Thank you, Dr. Montero, for that response. We do have a couple more questions in the Pathable chat window. Circling back to Delia's question, is there tribal set-aside funds within the CDC? Thank you.
There are some particular, no, so the short answer is no. The long, complicated answer is it depends what programs we're talking about. So if the appropriation language or HHS defined budget tells us you need to invest X amount of money in Indian country, then CDC can use that money to go toward Indian country. So that's in general the way that it works. Sometimes there are many actions and activities that are not funded within CDC because they are managed or funded within a different agency. That actually piggybacks a little bit in what my answer to the previous question was. So what is the extent and role of CDC's funding? I'm going to make this one up in mental health, when we have a substance abuse and mental health agency that does the same. So what is CDC's role? Coordinating and matching what we do with IHS. So all of these things need to be figured out as we move forward and how we fund activities in Indian country.
Thank you, Dr. Montero. There are a couple more questions in the chat box, and then we will go to Mary Bussing. Jacqueline Platero asks, this Delta variant is hitting our younger generation. What protocol is CDC taking?
So Delta variant is hitting all different age groups, especially those unvaccinated of any age, especially those unvaccinated of any age. So what we are trying to do is develop a specific strategies to encourage those who were vaccine hesitant to move beyond that hesitancy. And that is what it was brought up earlier. I don't know if Dr. Tremble, Dr. Wharton, or Dr. Anderson, or Dr. Stenger want to improve that answer with more specificity.
Thanks, Dr. Montero. As mentioned, vaccination is the key component of prevention strategy, regardless of the variant at this time. But we also recommend a layered approach that includes, in addition to vaccination, masking, physical distancing, when in indoor settings, improved ventilation, frequent hand washing. There are other factors that we want to see in conjunction with vaccination. But our overall approach for Delta variant doesn't differ because it is Delta. All of those same factors apply in preventing infection in the community. And I'll see if my colleagues have any other responses to add.
I would just echo everything that Dr. Anderson and Dr. Montero said, and then just add a brief note that, like mentioned earlier, the FDA has, anticipated some timelines in terms of approving vaccines for children. So I don't have exact dates at this time, and we do have to defer to the FDA process as the first step. But we do anticipate that in the coming weeks, so very soon, but definitely looking at a timeline before the end of the year, at having vaccines pending FDA review, likely available to younger children, so 5 to 11. And of course, that is our highest priority, is getting vaccines out to those who don't currently have access to them or who aren't currently vaccinated. But as Dr. Anderson said, it's also very important to take multiple actions to protect yourself and your family and your household members. And so vaccination is important, but it doesn't fully replace things like wearing masks when out in public, keeping a safe distance, looking for activities that can happen in areas that have better airflow and better ventilation are all really, really important things and are very important for young children as well. Thanks.
Just to add to what Dr. Trumbull just said, FDA did recently announce that their advisory committee will meet to discuss Pfizer's application for 5 to 11-year-olds later this month. So this is moving, perhaps not quite as quickly as I think many people with children in that age would like, but there is movement. And I think there could be an authorized or approved vaccine sooner than we had thought previously.
Thank you to my colleagues at CDC.
Thank you for those answers. And we have another question in the Pathable chat window. Janice Mendez asks, is the new self-test home COVID, I'm sorry, is the new self-home COVID test effective?
I heard if the new test for COVID is effective. Did you say cell phone test?
Oh, no. So is the new home administered where you can take the COVID test in your own home, are those self-administered COVID-19 tests effective?
Yes, they are, and they have a role in managing the pandemic because it would allow some people to take some personal decisions at home. Some people worry about others knowing about their infectiousness and status, so on and so forth. So those play a role, and as they are approved by the regulator, which is the FDA, it means that they fulfill some specific quality characteristics. Now, there are many different nuances in an approval for tests like that and the role that they play when tested at home. So I don't know, Mark, if in your discussions, Captain Anderson, sorry, with the team, you want to expand in that answer.
Thanks. Home testing definitely has a role to play in prevention, and there are a variety of tests that are available, and we're looking at the different options to assess their effectiveness in that setting. I think overall the message is a home test is better than no test, and that we would encourage people to test, particularly if they're symptomatic. And we've seen good results with many of these tests when people are symptomatic. And again, my colleagues may have more to add.
Thank you, Captain.
All right. Mary, I am asking you to unmute now. You can ask your question. You might need to unmute, Mary. You've been given the permission to unmute and ask your question now. You're still muted, Mary. You might need to hit the unmute button by hovering over your Zoom window and clicking unmute. We are still unable to hear you, Mary. So let me go ahead and ask Jacqueline Platero's next question. Is the latest report, in the latest report, it was stated that the younger adults are increasing. Is it mentioned that vaccination is the key to avoid the virus, but even those vaccinated are getting the virus? More education to students from the ages of 12 to 17 years of age needs to be administered.
Thank you. Dr. Tremble or Dr. Wharton, do you want to take it from the beginning? Dr. Tremble.
Sure. So it's correct that we're seeing an increased number of cases in younger adults later in the pandemic compared to earlier, and that we do think that that is related to the rates of vaccination. So in general, what we have found is that older adults have been vaccinated compared to younger adults and adolescents. But it is also correct that there are cases of people getting COVID-19 after they have been vaccinated. And I think that it's a little bit difficult because early when the vaccines first came out, the predominant variant, the primary variant that was circulating at the time, the vaccine was very good at preventing even infections. The vaccine really has always been intended to really protect against serious infections. So to protect against needing to go to the hospital, needing ICU care. And as Delta has become more common, we have started to see that there are more infections in people who have been fully vaccinated than before. And some of that is Delta. Some of that is also just that there are more people vaccinated. And that's a little bit of a kind of difficult thing to think about. But basically it just relates to when there aren't a lot of people who are unvaccinated, the only people who can get the virus are those who are vaccinated. And so sometimes it's actually just in groups and communities where there's high vaccination, then the people who get the virus are going to be the people who are vaccinated because there's just no other place for the virus to go. So there are a few different factors. And then our booster recommendations that we just issued are also related to some evidence that over time, people's protection from the vaccine, certain populations, certain groups rather, so older adults, those who have underlying medical conditions may have some decrease of their immunity over time. And that can also lead to more infections among people who have been vaccinated. But I want to really relay that the vaccines are still incredibly effective. And they're very effective at the goal that we have set for these vaccines, which is to protect against serious illness and hospitalization. And in terms of people who experience illness after having been vaccinated, the percentage of those people who wind up going on to need hospitalization or ICU care or becoming very ill is very low. And that continues to be true. And so it's very, very important to protect yourself through vaccination as soon as possible, whenever possible. And that's actually our primary message. Even though we are recommending boosters, it's not as if the people who we are recommending boosters for are suddenly unprotected. They're still very protected. And so these vaccines are really effective, but I appreciate the comment as well that we need to do better about reminding younger people who may not be as at risk of serious illness or getting very sick, very ill, needing hospitalization, that they too still need to be vaccinated because everybody is at some risk, and the vaccines can help, even if you do get an infection, really decrease how bad that infection is. So I thank you and I appreciate that comment. I don't know if other colleagues have additional thoughts they'd like to add. Dr. Wharton.
No, I think you covered it. Thank you.
All right. Just being mindful of the time, I will now turn the floor back over to Director Elgin to provide some closing remarks. Thank you.
Okay, so we have come to the end of our time, and I want to thank you, all the speakers for very much for joining us today, and all who shared your thoughts, comments, and questions. Everyone that participated. Dr. Montero, any closing comments to share?
Thank you very much for the opportunity to be here.
Okay.
And especially please listen to you, to the community.
I'm sorry, Dr. Montero, your speakers are very, it's hard to make out what you're saying, sir. Let's just give him a moment to put on his headset.
Oh, he muted.
Dr. Montero might be experiencing some technical difficulties at this time.
All right, then, I guess I'll just, again, thank you, Dr. Montero, and we appreciate you being with us today. We will be following up with you and your team on all the issues discussed today. We know that having this time is important, and also critically important that we track the progress of these recommendations. We trust that the agency will help to support our recommendations, and tribal leaders across Indian country will work to make sure lawmakers also know what our priorities are. So now we invite you all to join us for the National Health Equity Listening Session, which will begin shortly at the top of the hour. And again tomorrow for the conference's open plenary session at 12:30 Eastern. We hope that you will join us for those sessions. Lastly, please remember to stop by our virtual exhibitors hall and marketplace to see the great offerings and connect with the vendors. Thank you again to all our speakers and our audience members. So please take a few seconds at the end of the session to fill out the evaluation. You can find the link that says, please fill out this session evaluation under the session description on the session page in the online conference agenda. This feedback is critical for the work that NIHB does and helps us to improve our listening and consultation sessions in the future. So on behalf of the entire NIHB board, I wish you a good week and hope that you enjoy the rest of the conference. So thank you, everyone.
Thank you, Lisa.
Thank you, Vice Chairman. Good to see you.
Yes.